right, who has their driver's license on them today? Could you just take it out and lay it out in front of you? The waiting list for organ transplants in the United States as of October 15th, 2015, there was 122,000 people that are waiting for organ transplants. In Iowa alone, there's 597. The numbers don't include those who are waiting for tissue transplants. The amount of people waiting for organ transplants could almost fill up Jack Trice Stadium and Kinnick Stadium. My presentation today is about why you should be an organ donor. Some of the fast facts that I think just really speak for themselves as to why you should be an organ donor is another person is added to the waiting list every 10 minutes. An average of 22 people die per day waiting for an organ. And those are people of all ages, from infants to the elderly. A single donor can save up to 8 lives with organ donation. They can donate their heart, lungs, liver, pancreas, intestines, or kidneys. A person can save or heal more than 100 lives with tissue donation. From time of recovery of the organs to transplantation and surgery, these are how long the organs are viable for. So for hearts, they're only viable for 4 to 6 hours. Lungs are for 4 to 6 hours as well. Liver and pancreas are a little bit longer, including the intestines, for 12 to 18 hours. And then kidneys can be up to 48. So that includes the time that it takes to recover the organ from the donor, transport it to the patient that actually needs the organ. So it could be somebody that has an organ in California to be transplanted into a person here in Iowa. So that's pretty far way to travel, including in this time frame. Tissue donation possibilities. You can donate your eyes, skin, heart valves, bone, adipose tissue, femoral veins, and connective tissue. Skin grafts are for patients with severe burns or wounds. Bones can save limbs and replace joints. Heart defects for the heart valves. Adipose tissue promotes healing, regenerates bone growth, and is used as research. It's also used in packing around femur fractures or for cancer patients. I know we'd all like to donate some adipose tissue if we could, but they kind of need your femur along with it. Veins are used in vascular surgeries. They restore circulation. Femoral veins are used to wrap around the plastic ports in dialysis shunts for dialysis patients. And then the distal thoracic aorta is used to generate new vessels and used as a matrix for cellular regeneration. You can be even just an eye donor. Essentially, anyone can be an eye donor at the time of their death. Advanced age, cataracts, poor eyesight, and other medical conditions such as cancer do not prevent you from donating. So just because you have cancer, you can still help save another life. The cornea is used for transplants, sclera is used for glaucoma stents, and then the whole globe of the eye can be used for research. There you go. Just seeing this picture, you can see the benefits of helping somebody by donating a liver. The gentleman on this side, you can see he's pretty sick, he's hospitalized, he needs that new liver. And then on this side, you can see he's actually outside of the hospital setting. He looks like he's enjoying life because somebody was gracious enough to say yes to donate their liver. To become a registered donor for the state of Iowa, you can just say yes when renewing your driver's license. You can call the Iowa Donor Network, who is our state and local Iowa donor recovery. You can go to the iowadonornetwork.org, which is where I got a lot of my information. If you register with the DMV, you don't have to register online. Tell your family about your wishes to become an organ donor. Now, I know there are some people that are going to argue about why they shouldn't be an organ donor. Some of their arguments may be, the doctor knows that I'm an organ donor, they won't treat me. The first priority of the medical profession is to save lives when sick or injured people come into the hospital. Organ and tissue donation is not even considered or discussed until after the death is declared. Typically, doctors and nurses who are involved in a patient's care before death are not involved in the recovery process or the transplantation of organs or tissues. Another argument may be my family will be charged for the organ recovery, and that's completely untrue. Costs associated with recovering and processing the organs and tissues for transplant are never passed on to the donor family. Although the family may be expected to pay for the medical expenses incurred before the death is declared, such as the treatment and the hospitalization. A lot of organ procurement organizations are funded by donations from other people, and that's who mostly pays for organ transplants. Some people may also think that my organs will be sold on the black market. Organ donation organizations deal directly with the hospital and the hospital personnel and the patients. There's no privatization with organ donation. If you're looking for more information, and where I got a lot of my information is the iowadonornetwork.org, which is our state organ procurement organization. You can go to donatelife.net. That's more of the national, and then another national organization is United Network for Organ Sharing. Now pick up your license, and the face that stares back at you could be the victim of a fatal accident. If you could, it could be you, a friend, a family member, or anyone. Now turn your license around. Will you help? All it takes is the check off the box in the back of when you're registering for your license to become an organ donor and to help save a life.